Good morning, and welcome on behalf of ECMO Society of India, and also for this first inaugural conference of ELSO in this area of South and West Asia. And it's very, very heartening to see delegates from Iran, delegates from Indonesia, delegates from Sri Lanka, and a big group which was involved with Caesar trial in the UK, where Suneel Poobhoni was there, and Dr. Richard Furman and his group, which is here. Also welcome Dr. Ravi Tyaga Rajan, who is from Boston Children's Hospital, spearheading their ECMO program and the Pediatric Critical Care Unit. I come from B.L. Kapoor Hospital in New Delhi, was trained in the US, but ever since I moved over here, set up PICU at Apollo and now at B.L. Kapoor. We've just set up the ECMO program. Very, very heartening to see from all over India, people showing enthusiasm in getting this technology to save lives, both adult and pediatrics, both cardiac and respiratory problems. I know cardiac ECMO has been going on for quite some time for the patients who would not come off bypass after open heart surgery. But many, many children who could have been saved were not saved, probably because of absence of this technology in many of these regions. And H1N1 pneumonia, very severe viral pneumonias, ARDS, severe respiratory failure, really in adults and pediatrics combined has really led to the resurgence of this technology to the ICU, outside the operating room. And therefore, we now have cardiac anesthesiologists, the pediatric intensivists, the adult intensivists, the adult respiratory doctors, the cardiologists, perfusionists, all coming under one roof in this area of the world to build up individual ECMO programs. And we don't have Dr. Pranay Oza and Dr. Venkat, who actually were doing the real initiation of ECMO as we speak. They went last night, flew in emergency to put a patient on ECMO, but they should be here. But these are the people who really started it all in India, in Mumbai, at a small center, just upon their own passion and initiative, knowing the technology, which has gone really percolated essentially from West Australia, UK, and showed that it actually works. So this is their 110th case in the past 5 years. And I think that's a good, encouraging number that now at our individual hospitals and the rest of the India, we have done cases. Now we have some delegates here from Narayan Hridayalaya Hospital in Bangalore, who have been doing cardiac ECMO for quite some time. All India Institute of Medical Sciences, where Dr. Poonam Malhotra is going to be here with us, has been doing ECMO. And a lot of private sector hospitals. And of course, with Dr. Poobhoni moving from the UK over here, coming to KIMS, has set up an ECMO program, and in collaboration with Pranay Oza and some Mumbai centers. So there are actual cases of pediatrics and adult respiratory and cardiac cases that are getting done. And I think this is very, very heartening to see the kind of enthusiasm that we had in the past 3 days, where we did the ECMO training program, which has been going on now for past 4 years, with very, very enthusiastic 80 registrants who actually wanted to practice on the ECMO consoles, actually have been doing things where they have a problem, they brought it up and the queries were answered. So as a continuation of that, and the annual conference of ECMO Society of India, as well as the inaugural ELSO South and West Asia chapter, I'm very, very pleased to welcome you all over here in joining us in our first inaugural conference. Thank you very much.